Hello, friends. I'm glad you're here today because this is a very important and special presentation. It's all about caring for your spine, the most important part of your body, which holds your nervous system, your brain, and your spinal cord, and we need to take extra good care of it, even better care of it than we take care of our teeth, because it holds in it our ability to function, to control our heart, all our organs, our muscles, our glands, our blood vessels. It helps us coordinate all our functions together and to adapt to our environment and stress. So we all need that very badly. And that's what this presentation is about. If you are a patient already, I'm going to recommend this to you so that when you leave here, you don't mess your spine up, because you're going to be getting the best care when you're here, but when you leave here, you might be doing all the wrong things. So it's important to know what to do when you're not in my office. And if you've never been to me and you're thinking about it, well, this is a great place to start to get more information about the importance of your nervous system and your spinal health. So I have a question for you. What does health mean to you? I hear, when I have a group setting for this class, I hear things like health is looking good, health is feeling good, health is not having pain. Those are the typical things I hear, but health is so much more than looking good, feeling good, and not having pain. According to this definition, it says true health is more than just the absence of disease. It is the full expression of life. So if you break down the word disease, it's into two things, dis and ease. Dis-ease means we're not in ease, and ease means health. So when you're out of ease, then you have disease, and that means you're not healthy. However, you can look good and you can feel great and be very sick. Have you ever had this happen to you, where a friend or somebody you saw at the gym or on the sidewalk or at a store, and you hadn't seen that person for a while and they looked great and they felt great? You asked them how they were doing and they said, great, I feel great. And you're like, wow, you look great. And then a week later you hear that person dropped dead of a heart attack. This is something that happens all the time, because again, health isn't how you look or how you feel. It's actually how your body is functioning. That's really what health is. It's how your body is functioning. So I want you to remember that. Here's some more definitions. The Webster Dictionary says, health is the condition of being sound in body, mind, and spirit. The World Health Organization says health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmary. So, my friends, you have an amazing body. And as chiropractors, we have always had a deep respect of the human body. We saw all the amazing things it does, and we really appreciate it. Because your body came complete with 100 billion brain neurons that send impulses at lightning speed to every cell, tissue, organ, and gland and system in your body. Your body came complete with a very sophisticated nerve system that stretches for miles and stores over 100 trillion bits of information. Your body produces 8 million new red blood cells every second, and 100,000 genes in your body are there, with 50% of those genes designated to the structure and the function of the most important part of your body, which is your nervous system. So when your body is not happy, what do? You listen, you look at it, you respect it. You don't try to shut it up with meds and painkillers, because that's dishonoring your body. And you must have the highest degree of honor to your body, because without your body, you really have nowhere to live. Your body has a very important function. It's for you to take care of it, and for it to take care of you for a very long and a very healthy life. Are you good with plants? Because I have to be honest with you, I am terrible with plants. I don't know what my problem is, but they die a lot. And here you can see a plant that is really not thriving. So I have a question for you. What would you do if you had a plant like this? How would you take care of this plant? Well, some people say, give it more water. Others say give it less water. Some people say give it more light. Other people say give it less light. Maybe it needs to be in a different pot. Maybe it needs different soil. Maybe it needs plant food. Some people may want to just put a crystal in it. Who knows? But I'll tell you this much. If you really want to figure out what's wrong with that plant, you're going to try to find out what the cause of the problem is, right? You're looking for the cause. You're not just like crushing up a bunch of medicine, throwing some liquid in some water and then watering your plant. But isn't that how most people care for their body? They just take some medicine for whatever the ailment is, and then they expect it to get better. Well, that's not what you would do with your plants. It's probably not what you would do with your car, because if your car, the engine light came on, would you just cover it up with a piece of like duct tape, or would you actually try to find out the problem? Or if your pet was sick, would you just give them like a pill, or would you actually take them to the vet, try to find out what the cause of the problem is, and then correct it? Well, I ask you, my friends, to obey the natural laws of nature, which is to find the cause, look to the cause of illness always. And that's what we do as chiropractors. We're looking for the cause of your problem, not just basically trying to get you out of pain, because that, of course, will happen as we're treating the cause. So something you may not know, and that chiropractors treat something called subluxation. Subluxation, that's a very long term, and actually it's very interesting because if you break it down, lux means light, sub means less, and ation means the product of. So the product of less light. Isn't that interesting? Subluxation means your spine is out of alignment and it's blocking nerve flow, and that's what we're treating. We're looking for where your spine is out of alignment and where that nerve flow is blocked. So it can be all of these four things. It can be blocked pressure, or it can be pressure on your nerves. It can be blockage to your nerves. It could be tension on your nerves, or it can be elongation of your nerves that are coming out of your spinal cord and going to your cells. So when I see a person that's sick, I think there's three possible things wrong with that person. Number one, they're either toxic, which means they have too much bad stuff in them and they can't get rid of it. Number two is they're depleted, which means they don't have enough good stuff in them. They're weak and they're under the weather, but it could have been going on for a long time. They're not getting the nutrients they need from their food, okay? Or they're not getting enough water or whatever. And the other possibility is that they're not getting proper nerve flow, and that's called subluxation, and that is my specialty. I am a nerve specialist. I am not a back doctor. I'm not a pain doctor. I'm a nerve specialist. You can have all three. You can be toxic, depleted, and have poor nerve flow, or you can have one or the other, but we'll be able to tell you when you come here exactly what's going on when you get evaluated here. So I want to show you a little more about the subluxation. Let me just show you the little chart here. These are 4 x-rays. Each x-ray is a different phase of subluxation degeneration, which means that subluxation has been there for a while. In the first picture, you'll see the, actually, let's go to the full screen here so I can show you. All right, so this is the spine. See, it's a beautiful spine, but it is plastic. Yours is bone. And this is the front and this is the back. We cut, well, I didn't cut it off, but the plastic skull has been cut. And in here, you'll see there's a hole at the base of your spine. And that's where your brain stem comes through. Your brain stem comes through that first vertebrae in your neck and even a little into the second one. And then it becomes the spinal cord. And it goes all the way down to the base of your spine. Your brain stem, and your spinal cord make up your central nervous system. Again, that is your master system, controls everything. And what happens in the beginning of subluxation degeneration is that the spine loses its very important curves, okay? You can see there's curves. There's this, the middle curve is called the thoracic curve. That's your very primary curve. When you were first a baby, you only had that curve. Then as you got older, the curve started getting bigger. You had the cervical curve because your mom put you on your belly. And then you had the lumbar curve. All these curves are very important because they hold the discs in the proper place. So on the x-ray, you'll see these discs are clear. You can see they look like clear on this too, but they're completely clear on the x-ray, and then the bones on the x-ray are going to be the white, they look like marshmallows. And then the nerves you can't see because they're also soft tissue. So you're only going to see the denser tissue on x-ray, the bony stuff, and you won't see the soft. And you'll see phase 1, phase 2, phase 3, phase 4. And then I'm also going to show you really quick on these models. So I got these models here. I got 4 models here, you can see. All right, so this is the normal subluxation, and that's really healthy. You can see the disc is super juicy and thick. It's a cartilaginous like kind of a oval shaped. And then the bone is nice and smooth, that your vertebrae bone. And then you can see there's a nice big hole there where your nerve can come through. And this nerve happens to be super healthy and thick because there's no pressure on it because everything's so well aligned, okay? That's a normal subluxation complex, okay? The next is phase 1, so that you might have gotten a subluxation, and here we show that you can see the disc is starting to thin, and the nerve is getting degenerated there. It's thinner, and the bone is kind of sharp edges, and it's not as big as it was. So everything's shrinking, okay? Everything's shrinking, and there's less room for the nerve to come through. That's phase 1. Phase 2 is it's been there now for a good long time. Phase 2, you may have absolutely no pain. Still in this very degenerated phase, you might have absolutely no pain. That's why I said pain is not a good determination of health. But look how unhealthy that vertebral complex is. You can see there's all this ridging, there's all this degeneration. The disc has gotten so much thinner. There's even a slight bulging of the disc, and look at how degenerated the nerve is. This is an unhealthy vertebral complex, and you might have this without even having pain, and you don't even have to be old to have this. You could be relatively young and have this, and I'll tell you my story later. But if you keep waiting and waiting and the pain's there and you're just ignoring it because you're just sick of dealing with it and you're taking your pain meds, it's just going to keep getting worse. And here you got the phase 4, which is where you do not want to be, because this is almost complete fusion and complete, see that nerve is pretty much squashed, and it's no longer, there's not a lot of life going through that anymore. But even people that come to me in this severe shape can still get good improvement. Maybe not great, but good. And there's always hope. There's always hope. So let's go back to that the slide again. These are the x-rays of the 4 phases we just went over. And you can see the disc. So that first joint, you can see the interesting thing. The normal joint, there's a circle around that, and that's really a healthy joint, and the disc is healthy. Phase 2, which is mild arthritis. So again, you may have no pain at all. You might be actually really young during that, but you can see the whitening of the bones, and then the lack of height of the discs. And the cool thing is that, again, you don't have to be old, and that's what I wanted to just point out, that it's really important to know that you can have an old looking x-ray, but you can be young, and you can also have a really young looking x-ray and be old. So that age is not a determining factor of health at the end of the day. And then on that last one, on that third one, you can see the lipping, and it's starting to change. It looks like lips now because they're popping out. And then on that 4th one, by then you definitely are going to feel the discomfort, and hopefully you're doing something about it at that point, and hopefully it's more gentle versus invasive, because it's always better to take the least path of intensive treatment before you go on to surgery or more severe treatment, okay? Always take the most gentle option first. You can always get more invasive, but once you do that, you're losing function. So I always recommend the most gentle thing first, which chiropractic is always the best thing to start with. And it is gentle unless you go to a very rough chiropractor, but you don't have to. And there's lots of ways to take care of a person's spine with chiropractic. There's many, many kinds of chiropractic care. So you just have to find somebody who's gentle and that does a gentle technique. And there's lots of them out there, and I offer that as well. All right. Oh, go to the next one. Oh, all right. Beautiful. Okay, so all these spines are the same age, but they look much older, and I said that again. And I want to just share with you something really interesting. So when I was a little young human and I learned how to drive, I did not take driving very seriously. I guess I was kind of spacing out when I was driving, and no, I wasn't under the influence of anything, and I wasn't texting because there were no cell phones at that time, but I would definitely get into accidents a lot. And what happened was I went on to chiropractic school, and I was in my, early 20s, mid 20s. And then we had clinic where we were learning x-ray, and I had gotten my x-rays taken, and I looked at my x-rays and I could not believe my eyes. I was only in my early to mid 20s. I felt great. I looked great. I was like an athlete, and I was super strong and healthy, but oh my God, my spine looked like an older person's spine. I had very little disc height. I had already signs of arthritis, and I had absolutely no pain. So that is another reason why I tell you, my friends, we need to start early with chiropractic care, because as you're increasing your lifestyle of more trauma, because as we grow older and as we do more, we're subjecting ourselves to more stress, and our spine is the first thing that gets it often. We want to make sure there's no built up damage to the spine. We want to keep it healthy and strong with chiropractic. So we start with very young children, getting them checked. And it's kind of like your teeth. Like you would go to the dentist when you have pain, and then the dentist would do an evaluation of you, and he'd be like, whoa, there's a huge cavity in your tooth. And you'd be like, wait a minute, how did that happen? I just felt the pain yesterday. Exactly. It took time for that cavity to build, but you didn't feel it until it got really bad. And that's how it is with the spine as well. But isn't the spine a little more important than your teeth? Because you can always use fake teeth, but you can't replace your spine, not at least at this point. And your nervous system is very delicate, and that they still don't know how to do that. And let's hope, you don't ever need that. So that's just a really important little thing to think about. What lies behind us and what lies before us are tiny matters compared to what lies within us. Oliver Wendell Holmes. I love that because it's so true. Our bodies have this innate desire and ability to heal so much more than any machine or computer could ever imagine. And we should never give up on our health, ever. People with severe illnesses can improve their health if they don't have enough nerve supply. Then if they improve their nerve supply, they're going to improve their function of their body. And that's what chiropractic does. So I've had patients with MS, cerebral palsy, severe brain injuries, severe migraines, many autoimmune diseases, and even with cancer. And you know what? It may not cure the cancer, but the lifestyle and the ability to function is going to be so much stronger. And you never know. It could even cure the cancer as long as there's other lifestyle improvements happening at the same time. But chiropractic is a key to having a healthy body. And if you do all the right things, but you have poor nerve supply, you can't be fully healthy. So keep that in mind too. So what causes subluxations? There's three main things that cause subluxations, and they're basically stress to the nervous system. There's physical stress, there's chemical stress, and there's mental and emotional stress. So we're going to go through each one of these because it's important to know what causes subluxation so we can avoid it, or if we do get those things happening to us, we can get checked right away. So let's talk about some physical stresses to the spine and the nervous system. Well, the first one is what? Birth, right? Being born is pretty stressful. Whether you have a cesarean section or a vaginal birth, no matter what it was, however you were born, it's a lot for a little tiny baby and a little spine to have to go through, but it's necessary. And that's the first subluxation typically. It's always better to be born, naturally through the, vaginal canal. But if you have a cesarean section, it's really even more important to get checked because you're not having that stimulation to the brain when you're going through the canal, and you're also not getting all the fluids out of your lungs because when you go through the birth canal, it squishes your lungs, so all that fluids can come out. And it squeezes your brain because, you know, your brain plates are very flexible as a baby, and that stimulates your brain to work. So all these things are important. However, it is a stress, and we always recommend babies get checked immediately as soon as possible after the birth. So much can happen during that little time period, or it could be a long time period, and little babies deserve to have the best future possible. So what are some other physical stresses? Right, car accidents. Exactly. I gave you that one. How about falls? You're learning to walk. Oops, you fall down, or you tripped off the sidewalk or something, or you fell when you were doing sports in high school, or you did some very physical, you know, contact type sports like football or lacrosse or even baseball when you're doing the repetitive throws over and over. That's super stressful. Let's say you're not even oh my God, are you cheerleaders? Forget about it. Cheerleaders, actually, they get the most stressed bodies. And it's so important if you're a cheerleader, you were a cheerleader, to get your spine checked. Because even if you were one years ago, it's never too late to start getting that corrected. But how about lifting heavy objects? Maybe your job, you know, calls for sitting for hours at a time in a chair, which is the second, it's kind of, they say sitting is like the new smoking. It's really not good for us to sit. Maybe you're driving for hours at a time with your job or in your life. Driving is very stressful. It's a physical stress to the nervous system. Let's see, what are some other physical stresses you can think of? Sitting in a chair that's not like comfortable, sleeping in the wrong position. There's so many physical stresses. So I'm sure you have some good ones, but I covered a bunch of them. So let's go to the next one, chemical stress. We are living in a toxic soup of chemicals, unfortunately, unless you're living like in Alaska or somewhere up out in the wilderness. But here in New Jersey, where I live near Manhattan, the air is full of chemicals. The water is full of chemicals. And then we go to the supermarket and everything we're buying, we can't even read half of the ingredients because they're chemicals. And we're putting those in our body, which is making us sicker and sicker. So the air, the water, the food. And then what are you cleaning your house with? Don't tell me chemicals. I'm hoping you're cleaning with natural products, and you can even go online and make your own natural products with lemon oil or lemon, baking soda, vinegar. But if you're using chemical products, please stop. That's really not necessary to clean your house with chemicals, because there's so many great other options that you can do. And in the supermarket, there's super natural stuff that you can buy or make yourself. So let's see, what are some other chemical things? The pesticides. You're eating lots of veggies and fruits, but you're not buying organic. Bang, you just messed that up. No offense, you just didn't know better. When you know better, you do better. You need to buy organic or locally grown things because there's much less chemicals on that, okay? The closer to nature you cook, you make your food, the less processed food you buy, the better your health is going to be, okay? Go back to basics, you know, fruits, vegetables, nuts, grass-fed meats, and, you know, raw dairy. Those are the best. Organic, grass-fed. Please, you know, you deserve to eat good foods and to fortify your body with nutritional substances. And now let's go to the last one. Mental and emotional stress. We all know what that is, and we're in it right now, most likely. You know, you're gonna tense your body up. Your body's like so stressed, and that's just part of life. We can never get away from stress. What we can do is learn how to handle the stress. And that's what chiropractic does. It helps us adapt to our environment, but there's other techniques that you can do, and you're gonna learn that in the second half of this presentation. I'm gonna teach you some great things you can do to handle stress better, like the 3-part breath and essential oils and things like that. But meanwhile, get adjusted, because you could be locked in that fight or flight, and that's never a good place to be, because you're going to go down with the boat, and we need to be the center of the hurricane, right? The center of the tornado, the calm before the storm. And that's what chiropractic does. It helps calm you down. If you're overly stressed, it relaxes you. If you're too exhausted, it'll help bring you up and build your energy from within. So this is really important to know. And I just have a question for you. Have you ever been in a situation where you're either in a classroom or you're in a office, and those, I don't know if offices are still, a thing of the past, but there always seems to be the same people that get sick and the same people that are healthy. And it doesn't matter how much they're together, because there's going to be these same people that are always missing work, missing school because they're sick, and the same people that are never like missing a day because they're strong and healthy. So what's the difference? The sick people weren't able to adapt to stress. They kind of blow a fuse all the time whenever the slightest stress comes around. And the healthy people are able to adapt to stress. There's other factors besides having a healthy spine. They probably eat healthy. They probably get enough sleep. They probably think, better thoughts and things like that. But if your nervous system is out of whack, you're not going to be able to handle stress well. And that's something that chiropractic can really help you with. Okay. And that's basically what I just said. The adjustments help you adapt to stress, increase your adaptability to stress. So how does a chiropractic diagnose subluxation? So every chiropractic does it very differently. Some of us do posture evaluations. We all do really, but some of us do it on like software, and some of us do it by eye. Some of us do nerve scans. We look at or take x-rays, and we can see through x-rays exactly what's going, how old or how degenerated your spine is, how long you've had those subluxations, and then how much they can be corrected. We can see your spinal curvatures just by looking at you through your x-rays. We can feel your spine for misalignments or lack of motion, and that's an important part of chiropractic, is to feel the motion of your joints. If your joints are locked, then chances are you have nerve stress in that area, and it's just going to keep building up and getting worse if it's not corrected. We check your leg lengths. Your legs should be even. If they're not, that's a sign that your pelvis is out of alignment or subluxated. We can do weight-bearing scales, double weight-bearing, to see if you're holding more weight on one side than the other. There's so many other tools, range of motion studies, but at the end of the day, we're checking all these factors to see if you have subluxation. We're not just listening to your pain or your symptoms, okay? That's an important thing to think about. When you look at these pictures of these cute kids, I know what you're thinking. They're so freaking cute, right? But what is going on beneath the surface there? So a chiropractor looks at a person like an architect would look at a building. We're looking at the foundation, at the symmetry. We're trying to see how stable that person is and what's going to happen as they get older. So with this little girl, she's got knock knees, right? So her hips might be out of alignment, and the little boy is pigeon-toed. So he's a little bow-legged, so he might have problems with his hips down the road. She's going to have probably knee problems down the road. These are all things that need to be looked at as young as possible. The hips, one hip might be higher than the other. The shoulders might be out of alignment. These are all things that chiropractors look at and address to try to bring back symmetry to the body. So, because a symmetrical body is a much healthier body, just like a symmetrical building is a much stronger building. We also can look at your x-rays and mark them and see where your center of gravity is, and that is another important factor. There's so many different ways to evaluate x-rays, and we look at those. Anterior head syndrome, that's a really important thing, and we don't have to go to full screen on this, but I wanted to show you something on this little screen. So this is your spine. Your head weighs about as much as a bowling ball, I would say. So let's see. The bowling ball usually weighs, do you really want, okay. Bowling ball weighs what, like between 7 and 15 pounds? That's about what a head weighs, an average head. So you have this little neck, right? And this big head, or this big bowling ball. Now, will that head do better balancing when it's directly over the spine, or if you're holding that bowling ball right in the middle, or if it's all the way forward, which is what that text neck or forward head syndrome is. And trust me, when that head, which is close to, what is it, between 7 to 15 pounds, is hanging off your spine, you are going to be in a lot worse shape. Trust me. This is a new thing now with, I mean, it's been around, but now it's quite common, this forward head or anterior head syndrome. And it's happening younger and younger because of the devices, because of the, you know, computers and tablets and all that. So what can go wrong? The list goes on and on, because remember, the spine affects everything. Oops. It affects all the way below and all the way above. It affects the nerves that come out of the neck, which are your hands, your arms, your fingers, your elbows, your wrists. So carpal tunnel, numbness, tingling. But even in your legs, you can have sciatica just from forward head syndrome. You can have headaches. You can have carpal tunnel. I said that, TMJ, vision problems, hearing problems. You can have heart problems and breathing problems because your lungs aren't able to expand fully because those nerves to your lungs are being stressed. So it just goes, it's really important to have good posture, and that's something we can definitely help you with, because if your posture is better through chiropractic, or if you've never had good posture, then you wouldn't even know. If you've never been adjusted, you wouldn't know what good posture is. So we got to get you in a good place so you can at least know what it is to feel like your spine's aligned, and then start correcting it from there and give you exercises that you can do to keep it that way and get stronger and stronger. And then we talked about spinal curves a little earlier, but spinal curves are so important. And I showed you, you know, that the first thing that goes with subluxation is the curve. But that first, you know, the baby, when you're a baby, you got that little C curve. Like, we'll just do it one more time because I don't think it's not a bad thing to be reminded this. So we got this first curve, this amazing C curve. When you're born, you're just a little ball, right? And then your mom, or tell any new moms, if you know, they must do the tummy time. It's so important to do tummy time because that's when the two secondary curves get formed, which is the neck curve, because you got to lift your head, right? And it's very important to have a good neck curve, and the lumbar curve, because you have to lift your legs so you can walk and crawl and do all those important things. So curves are kind of like a spring in a way. If you think about it, go like this with your finger. It's like straight, bang, 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 right? Doesn't that feel like a lot of shock on your finger? Now bend your finger and do the same thing. Do you notice it bounces? How cool is that? It literally bounces because it's a curve, it's a spring. And that's exactly why we need the curves in our body, because that most important part of our body, our nervous system, needs to not have shock every time we're going over a bump when we're sitting in our car, every time we're, you know, walking or running. That impact is going to break down the spine, and we got to have those good curves and the good support of the muscle system as well, so that we can keep our spine and our nervous system healthy and strong. And those spinal curves are vital. So the adjustments help improve the curve. All right, so that's it. On the next video, I'm going to teach you all the things you can do so that you don't mess yourself up again. All right, but that's on the next video. Thanks for listening, friends. I will see you next time. Have a great day. I hope you learned a lot.